So being at UTHealth Houston, I really believe that we have a lot of advantages that we wouldn't have at other institutions. One of those is within my own department. We've got a lot of collaborators, we've got a lot of support that makes our research possible. But we also have multiple schools within UTHealth Houston that allow us to collaborate in ways that we wouldn't be able to at other institutions. We've got the School of Public Health, the School of Biomedical Informatics, among others that we actively collaborate with on a frequent basis. The research we do involves primarily two bacterial pathogens that cause disease in both children and adults, so across the lifespan. One of them is known as the strep throat bug, group A streptococcus, and the other one is group B strep, that's primarily a pathogen of little babies, so neonates, in older adults. So group B streptococcus is a bacterium that colonizes most typically pregnant women. And where we're most worried about that is when it causes infections in neonates shortly after birth. But it's also cause of disease in elderly adults, primarily adults with comorbidities such as diabetes, chronic skin disease, things of that nature. So it can cause anything from superficial skin infections to more invasive disease, bloodstream infections with high morbidity and mortality. So I think I'm most passionate about this field because of the potential impact that we can have on our patients. So part of my time is also seeing patients, and so there's always a direct patient relationship to the research that we do. So the fact that some of the research we do could potentially result in a vaccine, so prevention of disease, better treatments, better diagnosis, all of those things, we see the potential impact of those. And that really kind of raises the bar for us in terms of what we do. So I think I chose this field, one, because of the impact that we can have on patients, but from a research perspective, what I really like about this is the investigative work, being a detective, being on the cutting edge of research, learning new techniques. We're constantly learning about not just the bacteria, not just infectious diseases, but about our patients too. So what we hope to achieve in our research is not just in terms of ultimately helping patients in terms of prevention, new treatments and diagnostics. Something else that I'm really passionate about is training that next generation of scientists. So we've had multiple opportunities because of the success we've had in the lab. People want to come work with us, and that's a huge benefit for us because we get to train that next generation that goes on to do bigger and better things than we do.